Welcome. Thank you so much for joining us for the Pregnancy Justice and State Innovation Exchange conversation on legislative advocacy to end pregnancy criminalization. So I will move us on, and I'd like to introduce Laura Hernandez to talk a little bit about the work that State Innovation Exchange is doing and their partnership here.
Thank you so much, Ashley. Thank you, everyone, for being here today. My name is Laura Hernandez. I am the Director of Policy of Reproductive Freedom and Health Equity at SIX. I apologize in advance. I've been a little sick this week, so my voice is a little odd. And thank you again, Pregnancy Justice, for gathering us to preview your first ever state legislative blueprint. Before we get started, I'm just going to talk a little bit about SIX, our report team's work, and the legislative trends we are seeing affecting pregnancy criminalization. And then, of course, I'll pass it to our panelists, including SIX's own Reproductive Freedom Leadership Council member, Maryland Delegate Leslie Lopez, who we're excited to join us today. SIX is a national resource and strategy center that collaborates with state legislators to improve people's lives through transformative public policy. We support legislators by providing them the tools, research, and strategies that they need to shape impactful policies and strengthen their capacity to lead with and for their constituents. Our work spans several issue areas, including agriculture, democracy, economic justice, and reproductive freedom and health equity. By the end of 2024, we're still working on getting those 2025 numbers in. SIX had engaged more than 1,800 state legislators in our network out of the over 7,000 legislators serving across all 50 states, which represents about 25% of state legislators nationwide. And one of the key areas where we support legislators is advancing reproductive freedom and health equity, which I'll talk about more in the next slide. A key part of this work is the Reproductive Freedom Leadership Council, or the RFLC. The RFLC is the only nationwide network of over 600 justice-focused state legislators dedicated to championing reproductive health rights and justice. And through this network, SIX equips legislators with the tools, connections, and support they need as they work to protect bodily autonomy and advance reproductive rights in state houses across the country. And in the wake of the Dobbs decision and the many ongoing attempts to restrict reproductive freedom, this work is more important than ever. And that's where our reproductive freedom and health equity team comes in. We serve as a trusted year-round resources for state legislators. I see many familiar names in the chat, so it's really exciting to have some of you here. And we've worked and organized alongside you all across different political environments and provide you all with the latest research, technical assistance, strategic guidance, and hand-on support to help you champion reproductive, maternal, and gender-affirming care for communities. We also focus on skills building so legislators feel empowered, prepared, and confident in advancing policies to protect reproductive freedom. And together we're building a network of leaders who are informed, connected, and ready to fight for reproductive freedom nationwide. Our team also maintains an online database of videos, messaging guidance, talking points, and research on all the issues we work on, including pregnancy criminalization and fetal personhood. I'll make sure to drop those links in the chat after my presentation when I get a moment. So currently, our team is tracking 972 bills in all 50 state legislatures and territories affecting maternal health, abortion access, contraception, LGBTQ health and rights, youth access, fertility care, and of course, pregnancy criminalization and personhood bills. So this year specifically, we're tracking more than 50 bills nationwide that are attempting to criminalize pregnancy outcomes. Many of these proposals assign legal personhood to embryos and fetuses or expand criminal law in ways that can be used against pregnant people. Some bills, often called homicide bills, would add new criminal charges connected to abortion bans, and others introduce fetal personhood language into state law or expand the ability to file wrongful death lawsuits based on pregnancy outcomes. These numbers show how quickly these policies are moving through legislatures and the growing risk they pose for the criminalization of pregnancy. While the law does not directly ban, we're also seeing this, for example, in Puerto Rico, where the governor recently signed a measure in the penal code to to assign personhood to fetuses. And while the law does not directly ban abortion and abortion remains legal under Puerto Rican law, many advocates see it as a step toward that goal and one that creates uncertainty around the rights and autonomy of pregnant people. And to better understand these developments and what they mean going forward, I'll go ahead and turn it over to Pregnancy Justice, who will discuss the tools that state lawmakers can use to advance solutions in their first ever state legislative blueprint. And thank you to all the legislators and staffers who are here today to learn more. Ashley, please take it away.
Laura, thank you so much. Really appreciate the partnership with State Innovation Exchange and the work that you're doing to support legislators. So, with that, I want to kick it off and talk about why Justice is here and doing this work. So, our mission is to advance and defend the rights of pregnant people, no matter if they have give birth, experience a pregnancy loss, or have an abortion. And I'll move us along a little bit because I do want to get to the conversation. But we are so, so thrilled to be releasing our first legislative and policy blueprint. If you already requested it, you should have received it in email. But everyone who signed up today, everyone on this webinar, will get a copy of the full legislative blueprint. And you can also find a abbreviated version on our website. We are putting this blueprint out to support the work that has to happen at the state level. We understand that the federal government has shifted in ways we could not have imagined, but there is still so much incredible work that can happen at the state and local level. And so this blueprint is designed to offer model legislation. We offer background information on each of the issues, and we give recommendations on the ways that state level advocates, legislative staffers, and lawmakers can take action to protect the dignity and the legal and human rights of pregnant people. And we cannot emphasize enough, and I believe this so deeply, that the work that we're doing is incredibly important at the national level, but the people who are in your state house, the people who are doing the local organizing, they are the people who can best let you know what is needed. And so while Pregnancy Justice is excited to be in thought partnership with each and every one of you state lawmakers to the extent that we can be, we want you to continue to think about how you can partner with the advocates that are in your respective states, even advocates who don't use terms like reproductive health or reproductive justice on their website for a myriad of reasons. In the blueprint, we talk about the fact that there are organizations at the local level that are civic organizations, sometimes even faith-based organizations, organizations that are connected to housing justice or economic justice, but that are interested in supporting mothers and pregnant people, and that would be interested in challenging criminalization of pregnancy, organizations that you would maybe never expect. And so we just want to continue to emphasize how important it is to be in collaboration and sharing ideas with local organizers as we're defending our communities against some of the most aggressive attacks that we've seen. And I'll go to the next slide. And so I think we can go to this slide prior, but the blueprint outlines a couple of key issues, but under the umbrella under which many of our issues fall are pregnancy criminalization and prenatal personhood. Prenatal personhood and pregnancy criminalization are defined in the blueprint. And so these are terms that we hope to help lawmakers and legislative advocates understand more deeply. But we think of it as when the state uses criminal law to make any acts or conduct associated with pregnancy or pregnancy loss into a subject of criminal prosecution. So what someone does or does not do during their pregnancy, are they taking prenatal vitamins or not? What are the conduct, substance use during pregnancy? All of these things are ways that pregnant people and women are scrutinized that other people are not. And so pregnancy criminalization runs throughout the blueprint. The next slide, prenatal personhood. You'll hear us use this phrase. You've also heard us use the term fetal personhood. You'll hear us use it a lot. And we have resources on the Pregnancy Justice website that go in depth into the legal theory of prenatal personhood and why it's so harmful. But it's basically the idea that fertilized eggs, embryos, and fetuses should have the same legal rights as any other person. And that diminishes the rights of pregnant people. So, I want to take a few minutes here to go over some of the resources that pregnancy justice can provide for you and provide for lawmakers. So, the blueprint will go into a lot of different topics that pretty much overlap with the existing legal landscape maps that we have. So, if I can, I'm going to share screen for 1 second, and I'm going to show you the some of the resources that pregnancy justice is able to offer for all of you. And for each of these maps, there's also a corresponding, almost all of them has a corresponding report. So our most recent report is the after pregnancy loss report, and it was done by our colleague Kulsumi Jazz. And so here's a map of how different states address issues of pregnancy and pregnancy loss. And so this is a really heartbreaking, I think, tool, but it's really helpful to know that states that you wouldn't even expect sometimes criminalize or potentially could punish birthing people and pregnant people for how they navigate a miscarriage or a stillbirth. And so if you check out the website, you can click on the states and you can also click on the report. I'll run through this kind of quickly, but we have a legal landscape map around fetal rights through law and judicial decisions, state abortion restrictions. It's really important for us to also emphasize that prenatal personhood theory also has a direct impact on making IVF and access to reproductive technology very dangerous, making it less accessible. And so we have a map that outlines this, and there's also a report. We've talked, I think, in 2025 about advanced directives in pregnancy and how they have been impacted. So we also have some resources there, criminal feticide, civil commitment, and I think that is it. And so I wanted to just stop there, but encourage you all. And I think that the links are going into the chat right now, but I would highly encourage anyone who's interested in any of those topics to check out our legal landscape maps and the corresponding reports. So, with that, I want to move into this resource. So, this blueprint is designed to answer questions across a lot of the issues that pregnancy justice works on. We offer this blueprint to, put forth the key areas where we have expertise and where we can be in thought partnership with each of you. So, here's some of the questions that you might have that the blueprint might be able to help you think through. So, for example, we have seen bills introduced to offer child tax credits that begin at conception. Many lawmakers love child tax credits, and obviously polling data shows that the average person thinks that this is a really fantastic idea, and we would agree. The challenge is when child tax credits begin at conception, it opens the door for the prenatal personhood legal theory to take root. And so the blueprint will help lawmakers and advocates understand how we can advance tools and resources that create a social safety net for families and pregnant people without supporting the prenatal personhood legal theory. Another example, as I've mentioned, IVF is directly connected to and directly impacted by laws around prenatal personhood. So, what are threats to IVF and repro technology in your state? How can your state perhaps protect access to IVF? And we talk about that in the blueprint and how important that work is. Another really key area of our work is on the issue of substance use in pregnancy and the way that pregnant people are criminalized for their conduct during pregnancy. And so we want to think about what are state and municipal level approaches to supporting pregnant people who use drugs or who are navigating substance use disorder. What are some interventions that states can take? We offer some case studies, some that we can highlight from New York and from other states. And so even states like that you maybe wouldn't expect. So Tennessee, there's a case study from Tennessee. There are examples from New York and California. Finally, we want to think about why the prenatal personhood theory can impact women and pregnant people as it relates to family separation. So these are all some of the questions that we hope we have answered through the legislative blueprint. So, very quickly, I want to talk through some portions of the blueprint. I won't go into each of these for the sake of time, but I really hope you all can spend some time with your teams and talk about which areas of the law are impacting people in your state. What is the legal landscape in your state? What do you think you want to take on? And just like an elephant, how do you eat an elephant? It's bite by bite, little by little. We're doing work to be both proactive and sometimes we have to play defense to protect pregnant people. So we talked about the pregnancy loss landscape map, but there is also a report that is very helpful and it lays out the state by state analysis of how pregnancy loss is criminalized. Laws that date back to the, centuries ago around how a person might um, about concealment of birth that comes from the idea of people giving birth outside of wedlock. And so, why are those laws still on the books in your state? Find out if they are, find out what you can be doing to address that. And the blueprint offers some tools around that issue. And you can also find a link to that report in the chat. Another area that we're really grateful for Delegate Lopez's office and the leadership there, the lung float test, and how a test from the Salem witch trials is still being used to prosecute pregnant people for stillbirths and pregnancy loss. That's in the blueprint, and that's something that we would love to think with folks about in terms of proactive legislation. We're also thinking about how civil commitment, how people for example, in Wisconsin, face civil commitment for substance use in pregnancy, and how can we actually be putting forth meaningful support for parents that does not include punishment or criminalization. I'm going to move on to the next one. A couple more. We've talked about IVF. I know in some of the questions that have come forth from the registration, there's questions about viability bans, and we talk about that in the blueprint. We also talk about ending the incarceration of pregnant people, and I'm really thrilled that Kayla's on with us today to talk about that more. And we think about how horrific it is for pregnant people to be incarcerated to begin with, but on top of that, being shackled while incarcerated. And so while our work doesn't get in general too deep into conditions of confinement, we do recognize that dignity for pregnant people means that they are not subjected to incarceration. Finally, I want to highlight that the blueprint includes some tools and recommendations around budget and regulatory strategies. Many of the state lawmakers on this call, you all know how powerful and important budget season can be. We want to help folks think about how can we be using opioid settlement funds as an example to create more support for pregnant people in your state and in your community. We also mentioned that there are some social safety net programs in places that you would not expect. We talk about a universal basic income program, for example, out of Jackson, Mississippi, which is the only basic income program in the South, and how that local effort can be replicated in other cities around the country, even if your state legislature isn't yet ready to take on pregnancy criminalization. So, with that, I want to highly encourage everyone to spend some time with Pregnancy Justice's first ever legislative blueprint. We've put a lot of time and effort in it, and I'll move to the next slide and dig a little bit deeper into this is just another example. I kind of talked a little bit about this, but this is just what the blueprint looks like. We give you a little bit of background, we explain what the issue is, and then in the next slide, we give you solutions and recommendations, and we also will talk to you about states that are already taking action or that have taken action on this issue. So, in the example of pregnancy loss, we give the example of Washington State's Dignity in Pregnancy Loss Act. We also give you some other recommendations. I'll move us ahead. As I've mentioned, a big part of the issue of pregnancy criminalization is linked to the war on drugs and the racial motivations behind the war on drugs. And it permeates in every single state across the country, even states that are otherwise pro reproductive freedom. We still see moms and pregnant people facing criminalization or civil commitment based upon substance use. So, similar to after pregnancy loss, we offer a case study. I will take a quick second to highlight the work that's happened in New York City. The New York City Health and Hospital System made a decision to move toward informed consent for drug testing of pregnant people. For those of you who are not familiar, pregnant people in some places are drug tested when they go to give birth, and this erodes the trust between the pregnant person and their healthcare provider when they are tested without their knowledge and they had no idea that this was happening. And so when New York Health and Hospitals made this decision, a policy decision, they saw a significant improvement in the number of people who were facing child abuse or neglect investigations by the New York City Child Protective Service, so-called Child Protective Service Agency. They saw a decline of 80%. And so that means more parents were able to stay with their children and not go through the horrific process of an investigation or separation. There was a 90% decline for Black women and Black parents. And that is a way that the city of New York is addressing a racially harmful issue. And I want to make sure that the point comes across that the study found that there was no negative impact on newborn health and safety as a result of this policy of moving toward consent and engaging parents before and not drug testing parents, moving parents towards care and safety. And so across the blueprint, you will learn that there are really clear connections between maternal health and maternal health outcomes and pregnancy criminalization. So, here are some of the solutions and recommendations we offer in the blueprint around this issue. I mentioned opioid settlement funds, moving towards informed consent. I have to lift up the work that's happening in New York State around the Maternal Health Dignity and Consent Act and work that's happening in other cities and other locations to fund doula programs, changing the definition of child abuse and neglect. And we're looking to think about how we can make this happen in other parts of the country. And so, with this, before we hop into our discussion with our panelists, I want to just express sincere gratitude to everyone that helped make this blueprint possible. Our local partners in Oklahoma, in Alabama, Kayla, who's with us today, South Carolina. I think Tasha's with us today from New Voices for Reproductive Justice. Of course, the team at Six, Healthy and Free Tennessee, Drug Policy Alliance. I won't get into all of it, but thank you all so much for all of the support and advice and edits on the blueprint. And with that, I would love to shift to our conversation with our guest. I'm so grateful for the time and energy that you all have put into your work in your respective states. I know you all are doing so much to support pregnant people and women in your states and the work that you're doing with us today. So very briefly, I am joined by Kayla Pouncey from Restore Her, and I'm just going to give a very quick overview of Kayla's background, but I won't, and then I'll jump into Emily from Delegate Lopez's office. So Kayla is the Deputy Director of Restore Her US America. She's a policy strategist and emerging philanthropist, and her national work advances gender responsive justice and systemic transformation for women who are impacted by incarceration. Kayla calls herself a product of the American South, and she came of age within one of the fastest growing incarceration demographics. And she's deeply committed to understanding the structural drivers of women's criminalization and contributing to lasting solutions. Her career works on grassroots organizing, multi-sector policy design, national advocacy efforts, and I am very grateful to have Kayla with us today. And then I also want to read very briefly. Thank you so much, Emily, for joining us. Emily Charlep is Chief of Staff for Delegate Leslie Lopez, who could not be with us today. But my understanding from talking to Delegate Lopez this week is that Emily calls the shots. And I'm sure some of you who are on the call who are legislative directors, you probably are very familiar with the type of work that Emily does. But the delegate says that Emily tells her what to do, and the delegate does what Emily tells her what to do. But Emily's been Chief of Staff for Delegate Lopez for 3 legislative sessions. They met while working in the U.S. House of Representatives over 15 years ago. Emily has over 2 decades of experience in policy and politics. She is a policy generalist with a deep understanding of appropriations and budget, super useful. And she's worked in federal elections, Congress, nonprofits, the District of Columbia, and she's been a trainer and an educator for legislative groups. So I'm so grateful for both of you, Leslie and Kayla, for giving us some of your time today. So I'll just jump right into the questions because I think it's really helpful for our audience to get a feel from you to how can tools like this legislative blueprint be helpful for their work? How are you doing your work? And how can we advance these issues? So I'm going to start with you, Kayla. Many of the topics in our blueprint connect to the issue of maternal health, in particular, the way that the threat of criminalization can deter people from seeking prenatal care. The blueprint talks about the impact that abortion bans have on the number of doctors in a state, as well as the impact of incarceration on maternal health. So, can you talk to us a little bit about the Restore Her bills that you introduced this year, I believe, in Alabama and South Carolina, and why those are important issues?
Yes, absolutely. So, Ashley, thank you so much for inviting me. It's an honor and a pleasure to be here and share, what we've been working on. So, just to kind of start off, we have been working on a piece of legislation called the Women's Care Act. The Women's Care Act has been basically an extension of the Dignity for Incarcerated Women's Act of 2021, and also the First Step Act of 2018. So, with that, kind of, banning the shackling of pregnant women in prisons and jails, and also kind of, making sure they have the appropriate protection should they be parents or caretakers, making sure that the care that they're getting is gender responsive and appropriate for any sort of high risk situations. And so the Women's Care Act is actually closely connected to the lived experience of Pamela Wynn, whose story actually helped bring national attention to the treatment of pregnant people in custody. So her direct experience being incarcerated in a Georgia facility, during of which she was pregnant, and she was not aware of that until her initial physical examination. And during a transport, she was shackled. This was prior, of course, to the Dignity for Incarcerated Women's Act, but shackled at the wrist, the waist, and the ankles, which was a common correctional practice at the time. While restrained, she fell while trying to step into a transport van, and despite telling correctional officers that she was in pain and beginning to spot blood and needing that medical attention, she did not receive immediate care. She later hemorrhaged and miscarried while she was still incarcerated, while, receiving her medical attention. After that, she was still shackled at both of her legs to the bed with two male officers at her feet, being exposed to them. And during this experience, the doctor asked her what happened if she passed the baby, and the correctional officers threw the baby in the trash. And so prior to that, she was not what she would like to consider a political woman, but this experience deeply affected her, and exposed the reality that many correctional facilities do lack the adequate medical protocols for pregnancy, and that practices like shackling can create serious risk for both mother and baby. And so this has kind of been an important focus for us because, as you mentioned in the policy blueprint, the United States is already facing a maternal health crisis, and people who are incarcerated are at an even higher risk of complications when prenatal care is inconsistent or delayed. Many of these facilities lack OBGYNs, and pregnancy behind bars can become a major health risk. So the idea behind the Women's Care Act is to offer sentencing deferments for women who are, considered to be pregnant upon their arrest and booking. This is usually commonplace in a lot of correctional facilities, but the idea behind this piece of legislation would move this test up within 72 hours of arrest so that we would be immediately aware of any medical needs that may present themselves during the process of arrest and booking. But also the idea of ethical data collection around this so that we're aware of exactly how many women are being incarcerated, the need for these medical facilities, and ideally to be able to connect them with community care instead of traditional incarceration.
Thank you so much, Kayla. Thank you for the work that Restore Her is doing. Listening to Pamela Wynn's story every time I hear it, it just breaks my heart. And I have to just pause for a second there because that is a reality for many people who experience incarceration. And so wanted to pause there. And in addition to appreciating the work that you all have done to introduce this legislation, can you talk to us a little bit about how has it been received by lawmakers? What has been your experience trying to get them on board for moving this legislation?
Yes, absolutely. So currently, kind of like I was saying before, this kind of being an extension of the Dignity Bill. The Dignity Bill has been adapted in upwards of 30 states across the country at this point, but as we all know, not all of them. And then we're still seeing some implementation gaps. So I've been with Restore Her for a little bit over a year now. I've had the opportunity to work this bill in varying different states. This year, we have active bill numbers in Georgia, Alabama, Tennessee, and South Carolina. Last session, we were able to have bill numbers in Texas as well as California. The bill has already been passed in Colorado. But I would say that lawmakers' responses have been increasingly bipartisan. Many do recognize that improving care for pregnant people in custody is both a public health issue, but also a major fiscal issue for the state because when they're having to pay out these, millions of dollars in settlements, which are ultimately helping nobody because you can never really replace a life with money. But we've had to clear up a lot of misconceptions around the process of conception, medical needs during the process of pregnancy, but also the postpartum period and getting, the length of the postpartum period recognized, but also stigmas around why people ultimately end up in the criminal justice system, specifically really debunking those myths around substance dependencies and having it recognized as a medical condition rather than a criminal offense.
Thank you, Kayla. That's really helpful. And I think about in many states where we have begun to do advocacy, we see that lawmakers, many of just do not understand how substance use works or, the health needs. And I've been really shocked in my conversations this legislative session to learn how many people just don't know how birth works, don't know what postpartum period is. So just really appreciate the leadership that you all are demonstrating. It seems like this is a two-part. It's both like you're educating the lawmaker on just how this issue is impacting people and on why your piece of legislation can be responsive to that. And have you had to frame or reframe your issues to make it something that lawmakers find palatable? I heard you talk about the fiscal component of it, and it sounds like that's a really great strategy. Are there other tools or recommendations that you've had to use to help people understand an issue and then also get on board with your bill?
For sure. So I would say a primary element of our work is definitely emphasizing the importance of dignity and agency throughout the process of pregnancy and just how important it is to give people control over their own healthcare. And especially in the South, when we discuss agency over reproductive healthcare, it's often forgotten that the choice to carry a pregnancy to term, exploring that duality and the concept of choice is one that often comes with many barriers, especially for women that are navigating complex realities such as poverty or prior trauma, especially if any of those involve domestic violence situations where they're financially or emotionally dependent on a partner, especially if that partner is, the father of the child. But, just kind of exploring the people should also have the right to adequate medical care during pregnancy. We also have a responsibility to protect the welfare of children who already exist in the world and whose mothers may have experienced significant harms. So while advancing the Women's Care Act, we've sometimes reframed the issue to connect with lawmakers on existing policy priorities. For legislators who emphasize protecting life, we try to focus on the physiological and neurological development of a child during pregnancy and helping them see that if protecting life is ultimately the goal, then ensuring healthy prenatal conditions is essential. And trying to connect the dots to showing them that, a traditional carceral setting is not healthy for these prenatal conditions, especially in a lot of cases where we're seeing pregnant women who don't have access to prenatal vitamins. They don't have fresh groceries. They don't have spaces to exercise. And a lot of these people who are in the criminal justice system are young, so they're in their 20s. A lot of them are first-time mothers as well, and they're not even receiving anything as little as a pamphlet to explain pregnancy in general, so they don't know how to advocate for their needs. But the highlighting the fiscal impact has been incredibly important in the South. For example, Tennessee is one of the most expensive states, if not the top state, where childbirth is the most expensive. And so trying to represent to, our elected officials that the state is taking on and incurring this cost, and also any liabilities that accompany that. We've also found success in exploring the long-term implications for children and juvenile justice involvement. So talking about early maternal stress, poor prenatal care, and family separation, and how that can affect child development and increase the likelihood of later system involvement.
Thank you so much. That's so helpful. And I am in awe of all of the things that you all are juggling. It's incredible work. And yeah, I appreciate it. And thank you for the contributions that you all made to the blueprint. With that, I want to shift to you, Emily. Your office has introduced a lot of really powerful legislation. I think we talked this week, you said like, I can't remember, but dozens of bills were introduced just this session. You're obviously very busy. But last year, your office had passed legislation for, a taxpayer-funded abortion care fund. And so, how do lawmakers decide what issues they want to take on? Like when someone comes to you, advocates for pregnant people, let's say, what makes you all say, okay, this is something we can work on, we can come up with a solution to this?
Sure. Well, I want to thank you again for inviting our office and allowing me to step in for the delegate who's in a voting session right now in the health committee. I just would like to just before I get into that question, the bill that we passed last year is actually not even state tax funded abortion care. It's actually money that is surpluses from the Affordable Care Act mandate that states that require abortions to be covered by their Affordable Care Act insurance companies, that they charge $1 per person per month that goes into a separate account for the coverage of abortion in the state by those insurance providers. And there was a surplus. For us, it was $3 million every year. It accumulated to $25 million over the past 13 years. And so it actually wasn't tax money at all. And that's something that was interesting to our office, because something that does kind of grab our attention when it comes, especially when it comes from advocates who are really the experts on these really detailed, the ACA itself was 900 plus pages. People knew that there was this provision in there that was actually from a Republican who tried to tank the bill with it because they thought that people wouldn't accept $1 per month, not thinking that it was only in states that already required the abortion. So it was blue states that did it. They knew that was there. And they knew that money was accumulating, and we had to find the right time to kind of pounce on that. But and that's what bringing that idea to a legislative office to say, now is the right time, or that a landscape is necessary for this, is really helpful. So knowing those kinds of we call it finding money under the couch cushion, but it's really where those details are that make things really. I mean, the education of the body was a little bit, no, it's not too good to be true. Yes, it's free $25 million, basically. So we had to convince people that it wasn't too good to be true, but it was really good. And it was free money. And so having those kinds of understandings of what's going out there, and finding really novel and innovative ways to tackle an issue, especially the fiscal note on a bill, is really eye-catching for us. So I would say that, a lot of things do come from our advocates. Our bills this year, the two bills that we have this year that Pregnancy Justice has been really extremely helpful on, is the Pregnancy Outcome Protection Act, which says that the outcome of a pregnancy cannot be the sole piece of evidence for bringing criminal charges against somebody. And we also pulled off of our original Pregnancy Outcome Protection Act bill, the lung float test ban that was mentioned earlier. And again, that came together in a package to us because of a specific case in Maryland. But the way that we kind of tackled it was we were already looking at legislation based on the fact that Maryland had passed a reproductive justice constitutional amendment. And the language of that constitutional amendment, including no barriers from the state in order for people to exercise that right. So our idea in our office was, we're going to comb through current code and find what we think can be considered a barrier by the state. And we want to take it away, or we want to amend it. So the bringing of the attention of the Moira Agers case, who's a woman who's pending a retrial in a situation where she had a stillbirth at home, went to the hospital hemorrhaging, and the hospital sent police to her house and found the fetus in a bag. She was ultimately convicted of second-degree murder. She's afforded a retrial based on some kind of evidentiary issues, but the fact that the coroner decided that the fetus had been born alive based on this lung float test was kind of our impetus for saying, well, now is the right time to do it. But for us, it can come from a lot of different ways, but having obviously a state tie is very important in education, and especially in a deep blue state with a supermajority, there are still really important timing issues that you have to have under consideration. So we have a lot of bills that are on the back burner right now that we think are great bills, but we're in a $1.5 billion deficit right now. Last year we were in a $3 billion deficit. So we have to make sure that the things that we're changing now aren't fiscal high, that don't have high fiscal notes. So we're prioritizing things like this that don't have any fiscal notes, that are just changing of the code. So it's kind of a give and take of things come from us, things come from other people, but we want to connect to how this is affecting people in our state. So that's kind of the first step, is reviewing ideas based on what's currently going on in the state and how this change would benefit people.
Thank you, Emily. I'm hearing you say money, money matters. Like I appreciate the correction on the legislation you were able to pass around using the surplus funding. That matters. And also recognizing that many of the folks on this call are in states where there isn't, we're not everybody's finding a pot of gold here and there to do the things we want to do, but how can we get creative? And then I also heard you say timing. So making, considering the case that you mentioned, and which also our colleagues at Pregnancy Justice worked on, thinking about how that case and maybe the conversation that was happening around that case was a motivation, and in the states that are represented on this call, thinking about how that can be a motivation. And it also seems like getting into the nitty gritty, the weeds, the details, the things that people will miss out on, really help move legislation forward. So I know the blueprint is probably last on your list right now, given all of the work that you all are doing this week in session. But if you think about, from what you know about the blueprint, what are some things that you think might be helpful? What are you hopefully looking forward to learning?
Well, something that we learned while we were discussing with Pregnancy Justice and the other kind of core group of people that we brought together for our kind of drafting committee for these bills, we try to not put too many cooks in the kitchen, but we have people that we know are experts in this, and we want to make sure that it is legally sound as well. Something that we learned about in this process is the fact that when you are giving birth, you are given a drug test without your consent. It's the only time you're drug tested without consent. And so that's something that I don't think the delegate or I were really understanding. And through the process of writing this bill about the Pregnancy Outcome Protection Act, we did write in the bill that if there is outside evidence that could be used to start an investigation, that an investigation could start, but it couldn't just be based solely on the pregnancy outcome. Things like drug tests and things like that happen during labor or when you're in the hospital, is something that we specifically didn't write into this bill because we wanted to keep it as clean as possible, but things can always be added. So that is something that we're looking to understand a little bit better. We're really hoping to understand, what our current laws are and how they can be updated, because when you're in a blue state, sometimes you don't think about unintended consequences or about how any jurisdiction can take a law and find the loophole in it, independent of the overall goal of a law. So, cleaning that up is something that, in a blue state is always great to do, because it's just too easy to rest on the fact that everybody kind of agrees on the general idea. We had, 76% of the state voted for the constitutional amendment. That's great. But if there are still laws on the books that certain jurisdiction or certain people can use to punish pregnancy outcomes or people who are pregnant, is something that we want to make sure that we're cleaning up. So for us, it's making sure that the things that are in the blueprint are really tightened up in our state, and we're looking forward to continue working with Pregnancy Justice to make sure that all of these kind of individual additions to the laws that we're hoping to pass this year kind of make it stronger and stronger as we go.
Thank you. I really appreciate that. I really want to emphasize the legal landscape maps that we have, because for the folks I see, and I don't know where everybody's from, but on the call I see, we have people from Senator Webb's office in New York and Senator Guzman's office in Illinois, from states where you think we've done everything we need to do. we're like Maryland, and but we want to highlight that there's still so much work that can be done. And then for the people who are representing states where there's a lot of work to be done. I think Kayla, you've lifted this up. I think the blueprint has a little bit of something for everybody. It won't be everything. It can't cover everything, but we hope that it kicks off a conversation and that we get to continue to be in partnership with you and that you all get to continue to be in partnership with each other. With that, I'm gonna do one more question, and then I see we have some questions coming from the audience, both the folks that sent in questions when you registered and questions that are coming in now. So my last question for each of you is related to how we talk about our issues. So in the blueprint, pregnancy justice, and throughout most of our resources, we use the terms pregnant women and pregnant people somewhat interchangeably. And we do that because we want to make sure that we're bringing to light the ways that some of the laws around prenatal personhood and pregnancy criminalization are intended and are designed to criminalize women and have a gendered lens to it, but also recognizing the ways that patriarchal ideas are also working to erase gender nonconforming and trans people who are pregnant and who are parenting. And so we try to use this language with precision and we want to bring in inclusivity. And I want to think about with you, with each of you, how can advocates help lawmakers understand the language that they're using? And it doesn't have to just be language that we use around like pregnant people, but just Kayla, you mentioned something about incarceration and a lot of lawmakers just like literally not understanding how a person might come to be in a certain circumstance or the risk factors. I think we use one of our colleagues on the research team was talking about like social determinants of health. And I know that some lawmakers, when I come to them and I'm talking to them about the intricacies of our issue, it gets lost. What has been helpful for you in your conversations with lawmakers or what has been helpful when advocates come to you on an issue? What helps you get it, understand it? And also, I know that it has to be helpful to have something that you can bring back to your constituents and explain to your constituents why you're prioritizing one issue or another. What's helpful? What can help you get the job done?
Okay, so I would say that advocates can definitely help lawmakers deepen their understanding by supporting the ethical collection of data about pregnancy in the criminal legal system. So kind of as I was saying before, one of the key components of the Women's Care Act is a data collection provision that's designed to address a major gap in knowledge. So right now, usually when we're presenting statistics, it can be a little difficult to get numbers about these things because the organizations who are going into, the prisons or correctional facilities and engaging with the women to collect these numbers, kind of exposing these numbers and showing these statistics can put women who are on the inside at risk, especially in rural areas where there might be only a handful or one or two pregnant women. If we start talking about what pregnant women are experiencing, it could put them at risk of retaliation and also cause, their Department of Corrections to essentially block the other nonprofits or direct service organizations from coming on the inside, citing that it's a security threat. And so right now, one of the biggest issues and barriers is that states don't track basic information, such as how many pregnant people are being arrested or incarcerated, how many are already mothers or primary caretakers, what are also the pregnancy outcomes that occur while somebody is in custody, and how often pregnancy-related charges are brought. Specifically in states like Alabama, where we're seeing mothers who are going in for something that has nothing to do with a child endangerment or even a drug offense. And so somehow during their process, they're being slapped with a drug charge when they're taking these drug tests, and it's very hard for the DAs to standardize where it's coming from. And so that's kind of something that we are aiming to a gap that we're aiming to close with the Women's Care Act, because with the consent of the women to take the drug testing, we would have to have prosecutors standardize like where these things came from and kind of prove, what was the probable cause on drug testing these women, because that is a whole thing in itself. But if you were to look up how many women are incarcerated in a specific state or county, it's very hard to find unaggregated information apart from, the male people who are incarcerated. And so as you can imagine, it's very hard for lawmakers to fully understand the scope of the issue or design effective policy around it. So I would say that advocates can continue working with researchers, health systems, and even corrections agencies to ensure this data is being collected ethically and responsibility with protections for privacy and also dignity if they are under community supervision. And so, by producing this reliable information on who's being affected, what the outcomes are, and what it looks like in urban versus rural areas, advocates are more likely to help lawmakers move beyond anecdotal, information and make evidence-based decisions about maternal health and child well-being, but also the impact of criminalization in their region.
Thank you. I don't know, Emily, if you wanted to hop in.
Yeah, I think that that's a really, really great point. And in having data is so vital to what we do at the MGA. But there's also a place and time for using that information. I think that the connecting advocates to researchers is a great idea. I know Six does a lot of that, and we appreciate that a lot. But also, it's about messaging. So it's about who do you use what language with? Who's going to respond to statistics? Who's going to respond to personal stories? Who's going to be responding to legal arguments? What I teach when I do my grassroots and grassroots training is you got to do your homework knowing who you're talking to. If you're doing an advocacy meeting with a specific member, let's say they're on the committee that you want that you want to target, they're not all the same, and they're not all going to take the same arguments. And it does take a lot of extra effort to do that homework in the beginning, but it's vital to know who's going to respond to what messaging. And also you can rely on the sponsor to tell you, if you're talking to this person, this is a good tactic. And we try to give our advocates a lot of talking points, a lot of different opportunities, but we also want the advocates to be able to take something that we give. If we say, here's our one pager about the bill, putting it in words that make sense both for their organization and who they're talking to. Are you doing it in a kind of more conversational tone? Are you doing it as a researcher with a PhD and you want to talk about that part of your expertise? So I think that there has to be some balance, but also a variety. You need a variety of ways to say the same thing. And it also depends on what committee you're going to. For us, we split off the lung flow test that goes to our home health committee. And we already know that maternal health is a huge, huge issue that our committee has been working on for a very long time. We don't necessarily need to take time to set the stage there, but when we go to the Pregnancy Outcome Protection Act, that went to judiciary. We need to make more legal arguments there. The statistics on health may or may not sway people, but it's really about justice and about civil rights. So you have to do your homework, but also talk to your legislators and your champions, and be able to provide them with your different language perspectives, because it also helps them when they're talking. Is that not every legislative office is going to have a 20-year communications professional like we have in Delegate Lopez, or somebody who, like me, has 20 years of in the weeds legal experience. So you have to make sure that you have a variety of ways of talking about things. And I think that's really important, especially when you're talking about, do you say pregnant person? Do you say pregnant woman? If you want it in law, make it a pregnant person. You want the law to be inclusive, but your arguments and your oral testimony and your written testimony, depending on how you want to present it, can say whatever you want. So that's how I would kind of think about those particular questions. And then in general, having all of these different available ways to talk about the same things, depending on your audience, is vital.
Thank you so much. So talking about the issue in different ways for different audiences, something that I've learned in my career, we have to be able to shift. Lawyers, we talk sometimes and it reads like a brief, but that is not how you do testimony. So I also want to highlight the public opinion and messaging resource that Pregnancy Justice did alongside National Women's Law Center. My colleague Emma just dropped it into the chat, but for legislative staff and lawmakers, Pregnancy Justice did some research with everyday people, asking them them about the issue of prenatal personhood, which many people were not familiar with, had never heard of, but once informed on what it means, they made clear that they did not support that concept of diminishing legal rights for pregnant people. And so I want to lift up, with the few minutes that we have remaining, some of the questions that have come in through the chat. And if you still have questions, please do use the Q&A function. So one of the questions that came up over the last day with people registering was, what are some arguments for people and constituents who have religious objections to reproductive health and maternal policy? And that is why I think it's really helpful to refer to the polling information that we put into the chat, and the resources that are there. We worked with a polling organization to help us get that messaging. And so one of the things that I learned from that process is that, it's okay for state lawmakers or advocates to acknowledge that a person has a certain set of faith beliefs or religious beliefs. But when probed, most people do not support other people losing legal rights. And so if you work for a lawmaker who's like, I don't know, how are my constituents going to feel about this? Maybe this is a resource that might be helpful. I want to acknowledge the lawmakers who've joined us. I don't know if they're still on, but from Oklahoma, who've been doing really amazing work in Oklahoma and figuring out how to make the connection. There was a really wonderful briefing that happened last year in Oklahoma, where Matriarch released a report, and they helped people understand the issue of substance use and pregnancy, but they also brought in people, women who had experienced tremendous painful loss of their children as a result of the state's punitive policies around substance use and pregnancy. And that messaging and connecting the dots for people who proffer themselves as people who care about health and well-being, and connecting the dots between that and the real stories is really helpful. And so we hope that that is another type of that's another recommendation that we offer in the blueprint of like how to think about messaging, saying, but I really appreciate what you said, Emily, and I want to emphasize that as a growing edge for a lot of us, particularly legal advocates, learning how to talk about your issue in a way that is accessible and useful for legislative advocacy. And then I wanted to see if either of you had a response or anything you wanted to say to that question before I move to some of the other questions in the Q&A function.
Yeah, I'll say that last year because we had this constitutional amendment and we were trying to pass this public health abortion grant program law, we were really lucky to be able to have a district by district vote result for who voted for the constitutional amendment. All but one district voted in favor, more than 50%. That includes true red districts. And the one that was not 50% was 48.1%. We had some Democratic lawmakers who had religious objections personally. And by we, I mean the delegate has these relationships. She uses those relationships to bring to their attention 76% of your people in your district voted for this. So we want to give you the information that you represent this district and this is what this district said. We always said to them that, you vote your conscience and these people have voted you in, but here's the information and here's the data. And that's another reason why partnering with researchers, universities, all of these other institutions who gather this data for you that might not be readily available from the government, is really important because it paints a picture for lawmakers about what their district and what their constituents want. And it makes it just gives them more information when they're making their own decision.
Thank you. I don't know, Kayla, if you wanted to add anything, or I can hop to another question from the Q&A.
Yes, I'll make it brief. Totally 100% agree with that. I think the biggest thing that data does help show is that, the goal is to show where these faith-based priorities are. And so I've noticed that a lot of them involve, protecting life, caring for families, compassion for people in difficult circumstances. And I feel like one of the biggest things that we can help do is connect the dots to those things. Like, hey, if this is something that's weighing on your conscience, you care about protecting life, here's where the data and the research comes in. Like there's plenty of life out there that needs to be protected. And if the priority is that ensuring, babies are born healthy or supporting policies that guarantee prenatal care, safe conditions during pregnancy, naturally your priorities do have to align with that raises the quality of life, that offers holistic healthcare, that makes it easier for people, hypothetically to side and to make that choice, and to make the choice, whether it be, accessing reproductive health care through abortion or choosing to carry a pregnancy to term, making it so that you are representative of the people in your district, and you're not forcing them to a choice that's dependent upon circumstances that our elected officials are supposed to aid and help us with. So if medical treatment and lack of access thereof is one of those things that is influencing choice, then I definitely think that people need to be able to access all of the things that make their decisions feel supported and up their quality of life. So totally agree.
Thank you, Kayla. I want to answer Dawn's question in the chat. The question is, can you provide some general arguments that could be used for passing protections in the blueprint if there's a hesitancy in blue states because it's perceived as not necessary? So I'm assuming, Emily, that's a question for you. Some folks are like, been there, done that. We're fixed in our state. What do we need this for?
Yeah, what's actually really helpful is people do try to think like, oh, we're a bubble in our own state, but Maryland is the southernmost state with no abortion ban, with no restrictions on abortion, which means we get a lot of people coming to our state looking for that kind of service. So for us, we are affected by other states' laws. Being able to say these other states are taking this tactic or they're using this language now, and our current law doesn't address this, or our current law has a loophole because of XYZ language. The opposition is always changing their tactics, and we need to make sure that our current laws are always addressing that. And that's why kind of constant review of current laws are important, or doing something like a constitutional amendment that is really helpful and that can kind of supersede certain laws so that you don't necessarily have to change individual ones, is helpful. Obviously, that's a heavy lift, but the point is that the opposition keeps working at it, and so we need to keep working at it to combat it in the blue states as well.
Thank you. I have one more question that came up from one of the registrants, and I think maybe Kayla, it would be great to hear your thoughts on this. The person asked, is there a strategy for more conservative states to start with quote unquote winnable pieces of this plan? I think they're referring to the legislative blueprint. And yeah, how do people start with more winnable approaches? And I think it's best maybe if you give it an attempt.
Yes, I think that is extremely timely and applicable to, what we're doing right now, with the Women's Care Act, of course, working across multiple states and policy landscapes, especially when, we're looking at states in the South that can look so different internally. So it's like, how do we bring in a lot of those changes when we're working across state lines? I would say that in more states where there is a conservative predominant, number in the legislature, a really common strategy is to begin with the most widely supported and practical components of your, theory or reform before moving on to broader changes. So that's kind of essentially what the goal has been like and what our journey has been like, kind of expanding on the Dignity for Incarcerated Women's Act. So at the time, you know, I of course, that was kind of prior to COVID-19. And so the idea has always been making sure, that people who are pregnant do not belong in a carceral setting, period. But starting out with that, and as we see people say that one bad piece of legislation can take up to 22 years to resolve. And so that's kind of what we're working through right now. Starting with that, just recognizing that, hey, there is a need for these protections. And then moving forward to say, hey, we still have these protections, but kind of like the shackling bill, we do have, a legal standard for that, but there's a lot of still existing barriers that still involve implementation gaps. There's still funding issues, there's training issues, there's a lack of knowledge. And so a lot of that has taken shift into what we were talking about earlier is like right now we're seeing a very huge national trend of when we're seeing people be critical of these systems. Some people can perceive that as an attack on law enforcement. And so we've been trying to really walk the lines of like making sure that we're not, overtly trying to insult the intelligence of people who are working in these settings, but also having them acknowledge that even though they are trained to do this one thing, they're not going to be well versed in the idea of pregnancy and how to, process and the appropriate care for something as urgent as delivery. And so for example, in Tennessee, one of the starting points we started with was data collection. We do have a model bill of legislation for what the Women's Care Act would look like in its most idealistic form. But of course, not every single state has policy landscapes and existing laws that allow for that to be done safely. Like for example, in Alabama, working alongside, the strict chemical endangerment laws and how that's being carried out. That was something that really caused us to shift what the model legislation looked like. Because if we just slapped the model legislation in Alabama, it would have resulted in, it would have resulted in more pregnancy criminalization cases. So in Tennessee, for example, one place we're starting with is data collection because it's very hard to even get a lot of these issues recognized. And so we're like, hey, let's start collecting just a database of how many pregnant women that you all are seeing as a DOC with county facilities, and let's just start there. And so we're hoping that the next step or another winnable area would be basic health and safety standards, such as ensuring access to prenatal care, proper nutrition, and so on and so on. And so I think that, starting with cost saving measures as well, and not something that will immediately, impact the fiscal note or cost the state a lot of money, right off the bat as an introductory, to whatever your legislation is. I would not suggest that, showing a huge jump in numbers, and a huge policy shift often gives people cold feet, even if their intentions are good. It just scares people seeing those big numbers. And so I definitely think that, grounding the conversation in those three things like data collection, basic health and safety, and also cost saving measures is a really good place to start.
Thank you. One thing I thought about, maybe winnable is last legislative session, pregnancy justice tracked bills around fetal personhood and pregnancy criminalization, which is very, very connected to issues of drugs and pregnancy and the war on drugs and pregnancy. And we saw that North Dakota, maybe a place we would not have expected, passed legislation to protect birthing people when who test positive for drugs for them not to be reported to the state's child protective service agency. And that's not something that maybe we would have had on our radar, but it was maybe a convergence of priorities, both the fiscal cost, but also the conversation around the opioid epidemic has been a really helpful entry point for conversations around substance use and pregnancy and moving away from punitive policies. And that is something that I think maybe is a helpful answer to that question of thinking about what can be winnable. I think North Dakota successfully passed legislation. And I think, we might have some things that we would have done differently. I have, there's things about that bill that I'm like, oh, I would have loved it this way or that way. But they were doing what they felt was appropriate and winnable in their state. And my understanding is that a lot of people understood or had a loved one who were impacted by substance use or addiction, and moving people from understanding that issue to understanding the connections to pregnancy and why it was so important for pregnant people to get help and feel like they could trust that their healthcare provider wasn't going to get them into trouble. So with that, I want to say thank you so very, very much, Emily and Kayla, for your time. And Lauda, appreciate Six and your contributions and your support here. Thank you so much to everyone that joined us for today's webinar. We are really thrilled to be in collaboration and continued thought partnership with you around Pregnancy Justice's first ever state legislative blueprint. As I've mentioned, you will get a copy of the blueprint via email, and you can also sign up to receive pregnancy justice newsletters. I would encourage you all to poke around on the website, look through those legal landscape maps. There's also usually a report, we think, with every single map that kind of goes in depth and helps you understand those issues. And many of those issues are referred to in the legislative blueprint. Again, thank you for everybody on the pregnancy justice team, particularly Emma, our senior digital communication associate. I think I got your title wrong, but for the design on the blueprint. It's very much a team effort. So thank you all for joining us. Please do be in touch. The email for the full copy, if you have other friends who want the full copy, it's pjpolicy at pregnancyjusticeus.org. And you can also find the executive summary in the chat. So you can send that one pager or short version to your boss if you need to. And we are also looking forward to setting up some one-on-one conversations with organizations that are interested in advancing pieces of the blueprint in your state. So we really hope you will reach out to us. Thank you so much and have a good Friday.